All right, guys, welcome back. We're in chapter 20 now. This is vehicle extrication and special rescue. We're almost to the end, only one more chapter after this one. We're almost there. Let's go ahead and move into our national EMS education standards for this chapter. The first one we have is our EMS operations, knowledge of operational roles and responsibilities to ensure patient, public, and personal safety. Vehicle extrication, safe vehicle extrication, and the use of simple hand tools. Vehicle extrication, the safe vehicle extrication, and use of simple hand tools. Our introduction for this chapter, we're going to look at special rescue situations, including water rescues, diving problems. We're going to look at special rescue situations, including water rescues, diving problems, ice rescues, confined space rescue, farm emergencies, and bus collisions. At all times in any of these situations, the most important thing is that we make sure that we are personally safe so that we can then take care of the patients that we come in contact with. If we're not safe, we create another problem. If we're not safe, we create another patient and compound the problem. First, we're going to talk about extrication. When performing extrication, first we're going to talk about extrication. I know a lot of the people who are taking the emergency medical responder course, they are already involved in fire departments or other special rescue teams and may have extensive extrication training. If not, it's important to understand that it takes several hours of practical exercise to become skilled in performing some of these extrications. But just because you haven't been through that training and you're maybe not part of the team that is actually going to be doing the extrication, you should be familiar with the extrication equipment and the hazards involved in the extrication process, as we will be there and will probably be part of the extrication at some point, including patient care. So some of the protective equipment that we're going to use in our extrication is similar to firefighter gear and is often the same. We're going to make sure we have coats, pants, boots, and gloves that are able to protect us from any sharp objects that we come in contact with. To ensure proper care for our patients and to make sure that we can facilitate this extrication, many different agencies are going to be involved and they need to be able to cooperate in order for this to work out. Understanding the basic guidelines that might apply to you at your agency or might apply to other agencies who are responding to help you is going to help. So we need to make sure that we know the limitations of our training, equipment, and skills, and that we're ready and willing to call in additional responders early and make sure that we have the resources coming that we need. We want to make sure that we're able to identify any hazards such as gasoline, down power lines, or other hazardous materials that might be on the scene. And then we want to make sure that we control those hazards that we have identified using special equipment or the training that we have to mitigate those risks. We're then going to gain access to our patients. We're going to provide patient care and stabilization, and then move the patient if necessary prior to extrication. And then move the patient if necessary in an emergency situation if we don't have the needed resources or people there, just to make sure that the scene is safe and that we're not allowing them to come into any further harm. As an emergency medical responder, you have two primary goals in extrication, and that is to make sure that we obtain safe access to our patients and then to ensure that our patient is stabilized. We've talked about scene overview and scene size up and making sure that we're prepared for our calls in other chapters. Remember that this begins as soon as we receive the dispatch information. We can start to anticipate and plan for different things that we might need or that we might see when we arrive. The dispatch information that we should be receiving hopefully will include the types of vehicles involved, whether or not there's anybody trapped, if the vehicles are burning, or if there are any hazardous materials on scene that we need to be aware of. As you're approaching the scene and you're starting your overview from, remember what I like to call our 5,000 foot view, we want to make sure that before we exit our vehicle, we're getting a good overview of the entire scene. We want to have a rapid determination of the extent of the incident, how many vehicles are involved, over how much area is this accident taking up, an approximate number of patients, location of the different hazards that we need to be aware of, and then we need to make the call for additional assistance right then before we even step out of the vehicle and start and then we need to make that call for additional assistance right then, even before we step out of our vehicles. This is a good distance that we should be starting that view even before, but as you can see in this picture, they're back far enough that they can get a view of the entire incident. They see all the vehicles involved. They can see the entire width of the road. They can see down past the incident. It's a good area to get that overview. We want to make sure that we're keeping an eye out for any hazards that can result in injury or disability to ourselves, remembering that a lot of these patients who have been involved in motor vehicle accidents are going to have soft tissue injuries, meaning that there's going to be active bleeding. So we want to make sure that we are taking appropriate precautions to protect ourselves from their bodily fluids. We also want to make sure that we're protecting ourselves from any sharp glass or metal that's present. So if we are trying to protect ourselves from bodily fluids and sharp objects, then we may want to wear heavy leather gloves over top of our latex or nitrile gloves. If there is danger of splatter of blood or other body fluids, we want to consider using face protection, including a face shield and eye protection. We want to pay attention to traffic hazards. I've said this before, but we want to make sure that we park our vehicle in such a way that it protects the scene and protects us from oncoming traffic. We want to use our vehicle in such a way that the warning lights are used to our advantage for protection, and if we can position the vehicle so that we can use any scene lights or warning lights so that we can illuminate the scene and see better, that will be beneficial as well. That will be beneficial as well. Anytime we're working on the side of a road or somewhere where there is traffic hazards, we always want to aware. Anytime we are working on the side of a road or where there is a traffic hazard, we want to make sure that we are wearing approved safety vests or other reflective clothing that has been approved by our agency. Making sure that we're not wearing anything dark on the side of the street. We want to know that everybody can see us. Also, if it's nighttime and we want to make sure that people can see, we can also ignite warning flares and have them back, making sure that oncoming traffic is well aware of the incident scene up ahead. Bystanders are always a concern at any scene. Remember, as an EMR, one of our jobs is to make sure that we are able to control the scene, which means controlling the bystanders. So keep bystanders away from a crash by giving them specific directions. If we need to, we can use some type of police tape or other barrier to mark off the area that we don't want them to enter in. If we have specifically helpful bystanders, we can even put them on the perimeter and have them make sure that other people are staying away. With our spilled fuels, we should expect to find spilled fuels at any motor. We should expect to find spilled fuel if a motor vehicle has been hit from the rear or near the rear, or if it's on its side or upside down. If there is a fuel spill, we want to make sure that we have the appropriate resources responding. Most times that is going to be the fire department. We want to make sure that they are responding. If there is a fuel spill and the fire department hasn't arrived yet, we can consider throwing dirt on that fuel to prevent any sparks from igniting it. We can reduce the possibility of an electrical short that may ignite a fire by turning off the vehicle's ignition. We can disconnect the battery, but only if we have been trained to do so. Understand that hybrid vehicles and electric vehicles have multiple high voltage batteries, and unless you have received special training, you don't want to be accessing or trying to disable any of those batteries. Downed electrical wires are another hazard that we might have on scene. They can be caused by high winds, ice buildup, or even if a vehicle hit the utility pole, and that is the reason for the accident that you are being called to. If you do see a downed power line, you want to locate and note where they are, but stay away from them. We want to call the power company and let them know so that they can respond and take care of those down power lines. If the down power line is over a vehicle and the patient is still inside, we want to make sure that we instruct them to stay inside until the power company has been able to respond and shut off that power. Remember that down power lines can have electricity flowing through the ground. If they are laying on fences, we can have electricity flowing through the fence. So just because a down power line is away from us doesn't necessarily mean that we are completely safe from any danger. We want to assume that every vehicle we approach is unstable until we have done something to stabilize it. This may be ensuring that the wheels are chalked so you know that it's not going to roll. We can also reach in and set the parking brake. Another thing we can do is deflate the tires. We can do this by cutting off or pulling the valve stems. If the vehicle is on its side or upside down, we don't want to be climbing on these vehicles until they have been stabilized. We can break the rear window though to gain access into the vehicle. The main hazard that we want to be aware of with vehicles that are upside down is spilled gas. Spilled gas has the potential for a vehicle fire. We see a couple of different vehicle fires. The first one is going to be an impact fire, and these impact fires normally occur immediately after impact and happen because the gas tank has ruptured. These vehicles rapidly are engulfed in flames, and it soon becomes impossible for us to even get up and approach the vehicle to attempt a rescue. If there are passengers in there, they are usually rescued by bystanders who witnessed the crash long before emergency medical responders or fire crews or anybody else arrive on scene. The other type of vehicle fire that we can see is a post-impact fire. These post-impact fires are usually caused by an electrical short that These post-impact fires are usually caused by an electrical short that then sparks and lights the leaking gasoline. So to prevent these, we want to make sure and turn off the ignition. We want to extinguish the fire if there is one using a portable fire extinguisher. Remove the vehicles as soon remove the passengers from the vehicle as soon as possible. And like I said, if there is a fuel leak and the fire department isn't there, we can put some dirt or something over that gas, which will help reduce the amount of vapors that can be ignited. If there is a fire in a vehicle and you have fire extinguishers available, you can use a dry chemical fire extinguisher. You should ask anybody else if they have fire extinguishers from other vehicles on the scene. Use the fire extinguishers, as many as you need to extinguish the flames in the passenger compartment long enough for you to remove the patients from that passenger compartment. As we're spraying these fire extinguishers into the passenger compartment, we don't need to be overly worried about spraying these into the passengers. Just make sure that it's most important to suppress the fire enough to get them out of the quickly, moving them at least 50 feet away from the vehicle that's on fire, and then stay away from the front and rear of those burning vehicles, as the bumpers have compressed, as the bumpers are known to actually expand and shoot off in some vehicle fires. When you're trying to gain access to your patient, I'm sure everybody has heard this before, but you want to try before you pry. So make sure you go and you're trying all the doors before you start breaking windows or cutting the doors open. You want to ensure that the locking mechanism has been released. Try all of the outdoor handles. If you're unable to get in through any of the doors and the locking mechanisms have been released, then you may be able to gain access through a window. If you need to break a window to gain access, we don't want to be breaking the windshield. These windshields are made by These windshields are made of a laminated glass, a plastic laminated glass, so they aren't the easiest for us to be able to break and gain access. If we need to get into a vehicle and we're going to break a window, the side windows are the best ones. They're made of tempered glass. They break easily. We can use any number of devices to gain access through these windows. If you have some type of spring-loaded center punch, you will be able to get in. A lot of, like the EMS shears, will actually have a window punch on the bottom of them nowadays. If you hit the window in the corner, that glass will shatter and you'll be able to push it out of the way. If you do need to break a window to gain access to a vehicle and to gain access to a patient, try and break the window the furthest away from any patients. If there are patients in all of the seats, you need to try and find the one that has the most alert patient who you can talk to through the window. Maybe tell them to move away from the window or to cover themselves up as you break that glass. Once you have gained access to a vehicle through a window, we want to make sure that we are avoiding any undeployed airbags. We don't want to put ourselves between an airbag and anything else. If you are unable to gain access, if you can't break any of the windows, if you can't get in, then what we can do is stabilize the vehicle, protect the scene, make sure that everybody is away, and then wait for somebody to arrive with proper equipment that will be able to help us further the extrication process and gain access to that vehicle. The next step, once we have been able to gain access into the patient compartment, now we can begin to conduct a patient assessment. Our patient assessment is the exact same that we do on every patient. First, we're going to maintain and assess our airway, breathing, and circulation. We're going to control any bleeding. We're going to treat for shock. We can, at this point, stabilize the cervical spine if we're able to gain enough access to our patient. We can also provide emotional support for them. Remember, I've talked about therapeutic communications. That is a huge part of being an emergency medical responder, being able to remain calm and talking to our patients to help them to become calm as well. Patients who are in shock, including those who have been in motor vehicle accidents, lose the ability to regulate their own body temperature, and maintaining that body temperature is important for the body to be able to form clots. So we want to make sure that we're maintaining that body temperature so we can cover them up with a blanket and make sure that they are staying warm. Once we have gained access to the patient, we are in the vehicle, we want to make sure and leave those patients in the vehicle unless there is some type of immediate danger that would require us to move that patient. So if the vehicle is on fire, or if there's some other reason why we need to get them out quickly, then we would go ahead and do that. Otherwise, we want to go ahead and leave them in there until we can safely extricate them. Depending on the severity of the accident, it may require specialized tools and equipment to get the patient out of these vehicles. Some serious extrication situations can last 30 minutes and even more and require advanced training. As much as possible, we want to make sure that we are limiting the amount of time on scene. There's this idea of the golden hour where the less time we spend with a seriously injured patient on scene, the better. There are increased chances of survival for patients who receive medical care and specifically receive surgical care within an hour of an incident. Once we've gone through the disentanglement process, any of the parts of the vehicle have been cleared away that we can access the patient, we can dress and bandage them, we can make sure that they are stabilized, then we can start to prepare for extrication. Know that the route of access that we may be using for patient care and in doing our assessment and in treating some of those injuries may not be good enough for a route of extrication, for removing the patient from that vehicle. Once you do have a large enough area to remove the patient from the vehicle, then you will be able to package them for moving. Although as EMRs, we may not be directly involved in all of these steps, it's important that we're aware of the entire operation and really knowing that most EMRs are associated with fire departments or other rescue units. I would say that you probably are involved in more of these steps than even our EMS providers. So just a little bit of a review of the extrication process. If you anticipate that you're going to need extra resources for extrication, make sure that you're calling them early. Specify the number of patients, the number and types of vehicles that are involved. Make sure that you're not just standing around and watching and waiting for other people to do something. Identify any hazards. Make sure that our vehicles are parked in such a way that they are protecting the scene and us as we're working. We can clear a working area around the site by moving people or other equipment that aren't needed right there in the extrication process away, and then making sure that we are always thinking and paying attention to our surroundings. Remember to try all the doors before we start cutting or breaking anything. Once we've gained access to the patient, we'll do our patient assessment the same way that we do for everybody else and monitor their condition just like we would any other patient until we are able to actually extricate them from the vehicle. And above all, remember that as responders, if we remain calm, it will And above all, remember that as responders, if we remain calm, then those around us will sense that and they will remain calm as well. So next, we're going to start talking about a few of these other special rescue. So next, we're going to talk about a few of these other special rescue scenarios that we might be involved with. The first one is water and ice rescue. Remember, there's a few steps that we want to take. We don't want to be jumping in right away to rescue anybody. Being in water can be extremely dangerous. And as we're approaching victims who have been in the water for a while, they can be extremely fatigued and they may start to fight us as we're trying to rescue them. So we want to go through a systematic approach prior to us ever getting in the water. And that's going to start with reach, throw, row, and then go. So the first one is reach. If there's anything available, any poles or anything that we can stick out, if it's long enough to reach the patient and they can grab onto it, and then we can pull them to safety, that's what we want to do. The next thing we're going to do is throw. At a lot of our swimming pools and supervised beaches, they're going to have the flotation ring that has a string around it. We can throw that out to them. Also, a lot of public safety departments are carrying a rescue throw bag. This contains a rope and normally about 300 feet of rope, and you can take that and throw it out to them while you hold on to the other end. They can grab that and then you can use that rope to pull them in. If you don't have any of these things, or if you don't have anything that you can improvise throwing to them and pulling them back in, if you're able to find some type of small boat or canoe or some other way that you can approach them, once again, without getting in the water, then go ahead and row out to them. At this point, though, you are on the water. And anytime you're on the water, you need to have an approved personal flotation device. I honestly would say anytime you're involved in any call, even around the water, you should have one of these devices on. But for sure, anytime you are on the water, including in a boat, you want to protect yourself. As a last resort, if you don't have anything that you can reach the patient with, if you don't have anything that you can throw to them, and if there's no way for you to row out to them, you may enter the water to save that person's life. You should only enter the water if you are a capable swimmer who has been trained in life-saving techniques. You want to remove any excessive clothing that may restrict your movement or kind of weigh you down when you're in the water. And you want to take, not only do you want to have your personal flotation, not only do you want to have your personal flotation device on, but you want to take a flotation device with you so that you can assist that person that you're rescuing and they can have something to float on. Here's just a recap. Remember, reach, throw, row, go. If you are involved in a water rescue and you're going out to that patient, we want to make sure that we're maintaining an open airway, that we're establishing breathing and circulation for these people. Remember that a lot of our patients who are involved in water incidents are probably going to have some type of trauma associated with it. Often these are going to be spinal cord injuries because of diving into shallow water. So we want to stabilize any spinal cord injuries as well. Our patients who are upside down in the water, there is a special technique for flipping them over. You can see that in the skill drill slides that is included, but you'll want to go in, you'll stabilize under their head, grasping around their chin, putting your arm along their sternum, and then you'll be able to flip them in the water while they're still remaining in the water, and then they will remain in that position. Once you have flipped them over in the water, you can maintain their airway. You can use the jaw thrust maneuver if you suspect any neck injury, but you can also look, listen, and feel. You can start breathing for these patients. All of this can be done while you are in the water. The only thing you're not going to be able to do still in the water is actually initiate CPR. So if the patient has experienced cardiac arrest, we need to quickly stabilize the patient's head and neck, removing them from the water as quickly as possible onto a hard surface so that we can begin CPR. Remember that we want to assume the presence of a spinal cord injury if there is any. Remember that we want to assume the presence of a spinal cord injury in all of our water-related injury patients. So pay attention if they are reporting numbness or tingling in the arms or legs, if they're unable to move their extremities, or if they report any neck pain. If you have a patient that is not in cardiac arrest, that you have flipped over in the water and they're maintaining their airway, but we're still suspecting that there is this spinal cord injury, we are able to place patients on backboards while they're still in the water. And this actually works really well. Most of our backboards are made of a plastic or a fiberglass. So you'll be able to get alongside the patient. You can push it down in the water. As it pushes straight down, you can turn it and that will come up underneath the patient, and they are already in the correct position on that backboard. Next, we'll talk about diving injuries. Most recreational divers are using scuba gear. This is the self-contained underwater breathing apparatus. Our scuba gear consists of an air tank, a regulator, a mouthpiece, and a mask. Most of these diving incidents can cause trauma, near drowning, or specialized injuries. These specialized injuries associated with diving include air embolism and decompression sickness. Both of these are caused by air bubbles that are released as the pressure changes when we dive. As we dive down, for every 33 feet that we dive down, it adds the amount of pressure of 1 atmosphere onto that patient. So the farther down they dive, they now have multiple atmospheres of pressure. And then as they come back up, if there's a rapid ascension while they're coming up, then it can create that pressure change and allow these bubbles to be released. Those bubbles can affect the brain or spinal cord. Some of the signs and symptoms that we need to pay attention to with these patients are dizziness, difficulty speaking, difficulty seeing, or any decreased level of consciousness. If these bubbles cause a collapsed lung, then we may see shortness of breath, chest pain, or we can see pink, frothy sputum or spit coming from the mouth and nose. Another place that we can see some of these bubbles released is in the joints, in the fluid in our joints. They will start to expand and cause joint pain. Our treatment for these diving injuries, same as all of our other patients, maintaining our airway, breathing, and circulation. We want to make sure that we maintain a normal body temperature. So if they've been in the water and they are hypothermic, making sure that we are warming them up. We want to administer oxygen for them. There are some recommendations out there that say if we place the patient on their left side with their head slightly lowered, if any of these gas bubbles are circulating through their vessels, at that point they are not going to get stuck or travel through the heart or into the brain if we have them on their left side, head down. Patients who have been involved in diving injuries need to be transported to a Patients who have been involved in any of these diving injuries need to be transported to a hospital with a hyperbaric chamber. Not every hospital has these, so it's important that you know what is in your area. The next special rescue condition that we're going to talk about is ice rescue. Just know that any ice rescue is extremely hazardous because there's no such thing as truly safe ice. You don't want to exceed the limits of your training or put yourself or others at undue risk. You want to visibly mark the location where the person was last seen so that other rescuers can concentrate their efforts on that limited area. The basic rules for ice rescue are similar to water rescue. We want to try to reach, throw, row, and then go. If we are able to reach if we are able to reach the victim using anything that First, we want to try to reach the victim using anything that we have that can extend our natural stretch or our natural length. If we don't have anything that we can reach out with, we want to find some type of flotation device or rope that we can throw to the victim and then move on from there. As a last resort, that is when we will go out on the ice. Once again, only if we have been trained to and only if we have the proper equipment. If you must go out on the ice, you want to make sure that you do not become a victim as well. So as you are going out there with your equipment, one of the things you want to do is make sure that you have a rope tied around your waist. You're going to lie flat on your stomach and proceed across the ice, spreading your weight out as much as possible on that ice. If you are trying to access a motor vehicle that is on the ice and you need to get somebody out, this can be very risky as the motor vehicles are extremely heavy and can break through the ice. So we want to instruct the occupants to avoid unnecessary movement. If the vehicle is not going through the ice at that moment, we want to instruct the occupants to open the door. If they are unable to open the door, then instruct them to roll down the windows. This is so that they have a better escape routes if it does go into the ice. Anytime we are involved in an ice rescue, both the person that we are rescuing and the rescuer are at greater risk for hypothermia. So we want to make sure that we're keeping all rescuers as warm as possible, that once the people have been rescued and pulled out of the water, we are taking off all of their wet and cold clothing and that they are being dried and warmed. If we have rescued somebody from ice or cold water and they have no pulse, we want to start CPR and continue throughout transport, because if you remember from the earlier chapters, we're saying that they are not dead until they are warm and dead. So we can continue CPR, transport them, and have them warmed. Next is confined space rescue. These are areas that are meant to keep someone or something in or out. So our below ground confined spaces that we may be dealing with are manholes, old mines, chasms, or wells. Some of our below ground confined spaces that we might be dealing with are manholes, old mines, cisterns, and wells. We can also have ground level confined spaces. These could be industrial tanks or farm storage silos. Then some of our elevated confined spaces would be water towers or storage tanks. Whenever we are involved in a rescue situation with a confined space, there are two main hazards that we need to be aware of. The first one is that as we enter these confined spaces, there is normally insufficient oxygen to support life, or there might be poisonous gas present in those storage tanks. So we want to make sure that we have appropriate training and the appropriate equipment prior to entering those scenes. I actually had a call many years ago where we went, and as the EMS team responded, they found somebody down in a cistern. They went down to get them. Next thing you know, that EMS provider was down because they got down there. There wasn't enough oxygen. They became a patient. So then somebody else had to respond to rescue both of them. So don't enter any confined space unless you have some type of breathing apparatus. The other main hazard that we're looking at is there's always a danger of collapse in these. So make sure that before you enter any confined space that you are properly trained, or that you wait until somebody who is trained can arrive on scene and help you. Farm rescues can have some interesting challenges. A lot of times there is a delay in emergency response being called if farmers are working alone. So there may be a lengthy response time. It may be difficult for us to actually pinpoint the exact location of the emergency on their farm. And a lot of times there may be poor roads so that it's difficult for us to get our vehicles to the location once we do pinpoint where it is. Some other hazards that we will face on farms is animals. There are also a number of hazardous chemicals, including our pesticides, our herbicides, and our fertilizers. There are a lot of many farms use electrically powered machinery, so we need to be alert for shock hazards posed by the presence of electrical lines or other electrical devices, such as electrical fences or even pumps in irrigation ditches. And some farms will have tall barns or silos that may be difficult or might even be included as a confined space. Accidents involving farm machinery often involve rollovers of large vehicles such as tractors. We can end up with entrapment in machinery, especially in the PTOs of these machines. And then we can see severing of body tissue from sharp objects. The role of the emergency medical responder in farm rescue is going to be first to stabilize the scene and provide initial Your role as an emergency medical responder in farm rescues is going to be first to stabilize the scene and provide that initial medical care for the patient. And then we need to follow the steps of extrication. The first thing we need to do is shut off any electrical power or turn off any machinery that is still running, if at all possible. We want to call and we want to call and ask for assistance from fire, rescue or EMS organizations that can come and assist on this scene. We need to stabilize any hazards that we find while keeping ourselves and our patient safe. If possible, we want to gain access to the patient. We can then provide initial emergency care, establishing whether or not they are responsive, supporting their airway, breathing, and circulation, controlling any bleeding, maintaining their body temperature, and providing emotional support as we wait for additional rescuers to arrive on scene. As those rescuers arrive on scene, we can help them disentangle the patient and prepare them for removal, and then remove the patient. Because of the large number of people that can be transported on a bus, any bus accident, because of the large number of people being transported on buses, bus crashes may occur in any community. Crashes involving buses are considered a multiple casualty event, or an MCI. Our role as a rescuer at a bus crash, our role as a rescuer at a bus crash is going to be to perform that scene size up, call for any additional resources, and make sure that we have adequate numbers of resources that are responding, and then establishing an incident command system if there are multiple casualties present. Next, we need to make sure that we set up one-way communication with all the traffic. Next, we need to make sure that we set up one-way communication with all of the responding vehicles. And once we have a good count, we're able to start triaging those patients. With a large number of patients, we need to then start triaging them using the start triage system. In summary for this chapter, you should be able to perform the first 4 steps in the extrication process and assist other rescuers with the remaining steps. Ice rescue, water rescue, underwater ice rescue, water rescue, underwater diving accidents, confined space rescue, farm rescue, and bus crashes are situations that require extensive skill and specialized training, and we need to make sure that we are able to utilize the appropriate response systems and request additional help when necessary. In water and ice rescue situations, you can take some simple steps by helping the person without endangering yourself, including reaching out to the person with an object, throwing a flotation device to the person, or rowing to the person in a boat. If you're not able to reach them by either reaching, throwing, or rowing to the person, then you may have to go to them if you have the proper training. Remember that you may not be able to distinguish between 2 medical emergencies created by underwater diving, which are the air embolism and the decompression sicknesses. But any time that we have somebody who has been diving and has any of these complaints, we can provide basic care and then request additional resources to assist. In confined space rescue, our primary goal are to call for additional assistance and prevent other people, including ourselves, from becoming a victim. Farm emergencies and bus crashes are complex rescue situations. However, if you follow simple steps, you can often stabilize these situations and provide initial aid to your patients. All right, the review questions for this chapter. Which of the following would not be considered a special rescue situation? A school bus crash, a hiker who has fallen through thin ice, a diver who is discovered unconscious on surface, or an elderly man with chest pain at the park. And the answer for this one is an elderly man with chest pain at the park. Question 2, as an emergency medical responder, your primary goal in extrication is to use specialized equipment to access patients safely and stabilize them, reach patients as quickly as possible to administer pain medications, or dismantle vehicle or machinery. And the answer for this one is access patient safely and stabilize them. And our last question, once you have access to a patient, you should perform an assessment, rapidly extricate the patient, administer oxygen, or immediately begin treating injuries you see. And the answer for this one is perform an assessment. Awesome, guys. Honestly, I know that this chapter is probably review for a lot of you. Like I said, a lot of our emergency medical responders or people who are taking this course are already involved in fire departments and have more extensive training on some of these rescue scenarios. So thank you for making it through this chapter with me. We have one more, and I'll see you there.